Our next speaker was one of our keynote speakers last year. He's a holder of 30 patents. He's the winner of a very prestigious White Magnolia Award from Shanghai City. Dr. Sao has been in this field in so many ways. He is just wonderful that he's here again. Thank you so much. He is the CEO and Director of Cellular Biomedicine Group. And welcome. Look forward to your talk. Thank you.
Thank you very much, meeting organizer Dr. Yang, and for inviting me again. It's such an honor. Last year I realized my speech was after Dr. Kaplan, and so thank you very much. CBMG is a small company, but we are well positioned. We are OTC QB company in the US, so we are uniquely positioned in the vast China market. We truly feel like we are kids in candy store managed by grandpas. We carefully went through all the disease lists and the technology platform we have, what disease we choose, and we come up with a conclusion. And in the dynamic environment, and considering the market space and market size and technology know-how we have, the platform we set up, so we select autologous adipose-derived mesenchymal precursor cells for osteoarthritis. Next slide, please. Again, we are a public company, so this is necessary. And without overdue, just simply I will mention this one message. In osteoarthritis, it is a huge market. Combined in China and the US, the osteoarthritis patients is over 100 million. And it's fastly growing. The adipose-derived mesenchymal stem cells is proven to safe by many in vivo studies, and in our own hands, we have plenty of animal studies also prove there's no toxicity issue, no chance of growing tumors. The mechanism of HAMPC is also well documented, and the trophic effect, in my personal belief, is the key mechanism of action. And as we walk through the animal studies. With preclinical studies, we use New Zealand white rabbits. So it's the cell we use is a human cell. So it's a xenotransplantation. And that suggests it's the allogeneic effect or immunogenicity is not a key side effects here, or a key factor will prevent any therapeutic effects. And I'll walk through this appears complicated design, but we try to address several questions here. Now, this is one of the studies we completed, but we have other animal studies, goat and dog studies ongoing to clearly define what is the mechanism of actions. And it's important to understand the model is very common, applied in many studies in this field. The control here is HA, high-uric acid, and 3 injections is given. And the low dose of mesenchymal precursor cells plus SBF, which is also commonly used in orthopedics field. And the medium dose and high dose, and the final group is a pure NPC. And this is a study design. The surgery is done day 0, and then 8 weeks later, 6 weeks later, 9 weeks, and 12 weeks, and the study completed in 19 weeks. And 3 injections delivered, and multiple sampling time along the line. The serum level of inflammatory cytokines was also measured. And as you can see, the two groups, which is the MPC group or MPC plus SVF group, are able to reduce the cytokines in the time of 12 weeks and the 16 weeks time point. And this is the morphology. The control group and the low dose group, HA group, almost there's no therapeutic effects. And the high dose of MPC plus SVF or the MPC alone is able to reverse the osteoarthritis to a certain level. Again, this is qualitative, it is not quantitative. I have quantitative data on it. And macroscopic evaluation clearly shows the therapeutic effects of MPC alone or MPC plus SVF. HA staining, as you can see, the HA doesn't have too much therapeutic effect. Low dose of concentration of MPC, the morphology remains the same as the HA control. In the middle dose, and the high dose is getting very, very good. And the MPC alone, very similar. The classical staining for college and vascular staining again shows HA control, low dose, mid dose, high dose, MPC alone. Very consistent. Collagen 2 expression, again, very consistent. MMP13 expression, which is secreted by chondrocytes, dissolved collagen, which means the lower the better. And you can see MPC and the MPC plus SPF shows similar effects. To some extent, MPC in all these data shows superior results. Manking score, very consistent. These two groups stand out. In collagen thickness, this is the time point of about 19 weeks. Again, shows statistically significant increase. To conclude, the preclinical studies and the therapy is safe. We call it ReJoin, safe, and it can reduce inflammatory cytokines, reduce mankind score, reduce MP13 expression, and increase collagen thickness, and ICRS score, collagen 2 expression. And we move on with the clinical studies. So it's a phase 1/2A design. We had 18 patients successfully recruited, and 3 doses were given, low dose, medium dose, and high dose. And the cell numbers of each dose is commonly described in many publications. So, and no surprise, the medium dose and high dose shows therapeutic effects. The procedure is quite straightforward. I just want to point out, because of our know-how, the high yield of mononucleoside, including mesenchymal stem cells from SVF, is so high. So we only require 30 cc of fat versus the conventional method. We might require 300 or 200 cc of fat, which prohibits a lot of Asian patients to participate in this therapy. And SVF is purified, now the cells are cultured in CGMP facility, and the cells are either frozen or shipped to hospital for injection. To summarize the safety evaluation, there is no severe adverse events observed. There is no other changes in life sign and lab parameters. So it is a pretty safe procedure. And this is the data of 3 months post-therapy. We have 6 months. We have not completed data analysis, but I can tell you that 6 months confirm the 3 months data. And all the parameters, WOMAC, and the pain index, and the walking distance, and well-being, all significantly improved. And if we quantitatively, semi-quantitatively define 25% pain improvement as a no effect, then we see about 85% of patients have this enjoy therapeutic effects. And this is a very preliminary, again, we have not completed 6 months data analysis. 6 months confirmed, 3 months data. And MRI data 3 months, we see in some patients the bone marrow lesions improve dramatically. And most exciting, as most of you are aware, that on January 14th, a Korean team has reported they have seen significant increase of the collagen regrowth in the lesion area at the time point of 6 months. And to our surprise, we have seen a 3 months time point, 3 months. And previously, authors reported using bone marrow mesenchymal stem cell, they have seen collagen regrowth and meniscus by definition of their 15% regrowth as a positive. They have seen a time point of 6 months. This time point, we see regrowth of human tissue and collagen in human studies. And on the left side is the median dose, shows statistically significant difference. And on the right side, this is the delta, because the baseline of each group is very different. So we have to subtract the baseline to show the delta of tissue collagen thickness. And it's kind of appreciated as a kind of dose response. And the 6 patient group. So to conclude, this ReJoin cell therapy is safe in human studies, and it's effective, reflected by primary observation parameters, WOMAC, and so on, and also collagen regrowth. Additional studies is ongoing to elucidate mechanism of actions in detail. And I want to end here by acknowledging to all the teams, participants, our teaching hospitals, multi-centers. Thank you very much.